things that we have undertaken to do in collaboration with the Ministry of Tourism and Culture and in collaboration with Social Welfare Department and also in collaboration with the Child Protection Alliance.
Well, call it mystery as the main character in our story puts it. However, there's something fundamental about the rampant cases of fire incidents in the greater Banjul area. This has often provoked a series of questions about whose house is safe from a raging inferno, which sometimes strike without notice. One Dembo Conte of Kololi claimed that he dreamt about the recent fire that got at his compound. Our reporter Louis Mendy picks up the rest of the story.
The Conte Kunda family of Kololi is trying to reconcile with the devastating effect of an inferno which left the occupants with nothing to inherit from the blaze. The incident took place on Sunday, the night of the Korite Day. Dembo Conte is the landlord. From him, I understood over $76,000 in physical cash was burnt during the blaze. Nothing kept in this house was spared by the inferno, from laptops, food items, clothes, and jewelry, all consumed by the raging fire. No casualty was reported during the incident. Dembo told GRTS that on several occasions prior to the incident, he dreamt of fire consuming his house. Since then, I was consistent in giving out charities, hoping for divine intervention, but to no avail, he said. He explained it was because of his dreams that he warned the family never to lock the main door of the house when going to bed. On the night of the incident, only the security gate was locked, a situation that allowed Dembo's family to immediately slink out of the house when it was struck by the blaze. Virtually left with nothing, Dembo, with 2 wives, a mother, and 6 children, is finding it tough to put food on the table for his family. His plea to good Samaritans is that of immediate help. With the main house reduced to smoking debris, Dembo's family's female wing is sharing these 2 single rooms, previously the boys' quarters. The victims can reach for aid on the following numbers: 998-4798 or 39-69672.
More, how comes a mere dream about a fire incident actually becomes a reality?
Well, that may sound strange for an individual, as we have seen in the story. He dreamt that his house was on fire, took all the precautions, did everything, suddenly woke up, and it happened. I think for those people who are not superstitious, people like me, will just dismiss it as coincidence. But others who are deeply superstitious, I say, well, if I saw it coming and it happened. Yeah, so it is a strange dream. I don't know, maybe he should go, he should seek maybe someone who is, an interpreter of dreams. But the dream has already been interpreted because he's seen it happen.
It has already
happened. For me, it is
happened.
very strange. I cannot just understand.
Indeed, more strange things happen.
Yeah, sometimes, so this means, if we dream bad things, as we do, many people dream about bad things, but they never happen. So that means we should be wary. Once you dream about a bad thing, it may happen.
I hope anything I dream bad doesn't actually become a reality. They lack in dark corners, sometimes scavenging for food or anything. Well, they should not be left alone. Society should do more to support mentally challenged individuals. However, there is some encouraging news with the advent of groups that are developing friendly approaches towards people who are mentally challenged. Dauda Samba was the guest on Talk to Weekend Spectrum.
First among all is our understanding of what mental health issues are. Most of the times we misinterpret it with the belief that only the people at the psychiatric hospital or the ones seeking outpatient treatment are the ones suffering from mental health problems. No. Even the guy in the office that works every day and closes by 6 before getting home, it's 9, the following day you have to work again. These stressful factors at work have mental health issues as well. The guy receiving the customer care calls at the GSM companies also have issues because you receive hundreds of calls every day. And these stressful factors of the calls you are receiving every day has a psychology in your system. It has the ability to give you some problems. But also the military man standing outside every day from 8 to 8, the police officer on the street. These are all issues that have mental health implications. So when we talk about mental health, we are not only talking about people with mental illnesses that are at outpatient, taking outpatient treatment or at our psychiatric facilities. It covers everyone. We are shifting from what we are calling institutionalization, that is giving care to people who are only admitted in our health facilities, but also going around the community and in offices to talk to these people so that we can all understand together that the issue of mental health goes beyond illness itself. We are talking about health in general. And when we look at the simple definition of health or the explanation of health, health in simple is both physical, mental, and social well-being. So you can see that mental component of that definition of what is health in general. But also, we have another challenge is the human resource. Unfortunately, the Gambia has only one trained community mental health nurse, who is currently the matron at the Tanka Tanka Psychiatric Hospital. As I'm speaking to you, we don't even have one registered nurse inside that hospital. Most of the nurses that were there have traveled or have stopped working in the hospital. So capacity in the health facility, but also in other health facilities around the country is a problem. This is why the community mental health team has a greater role to play, because most of the staff in that hospital, in that service or team, are not trained mental health personnel. So the country has another challenge in terms of capacity as well. But also our finances towards mental health itself. Mental health, when you look at our estimates, about 13% of our Gambian population has some mild or severe form of mental illness. When you look at the budget we spend in mental health, it's only 0.54% of the total budget given to health by our government. This is very limited. We are expecting that our government, our ministry should be spending between 10 to 20% of the total health budget in the area of mental health, because mental health goes beyond the hospital level. It's also talking about that person in Basse that has no one to take care of. It's also talking about that guy that should be trained in psychology, in social work, in occupational therapy. So it's very, very broad. Mental health finances is also one thing that is also lacking. But community mental health services, as I said in the beginning, we have a team of 4 people who are expected to cover a population of 1.8 million. You can see that strain of capacity and resources that this team is undergoing. So we need to improve in this area as well. But also when we look at our policy and act, unfortunately, the Gambia is one of the few countries in the world that is still keeping what we are calling the Lunatic Detention Act of 1917. Imagine by then, our colonial masters were using some of these tools to detain and restrain people. Anybody who did not give in to their ideals will be termed as a lunatic by then. So we have to look at this Lunatic Detention Act and call it the National Mental Health Act. It is time that the ministry, the government, and National Assembly members look at this act. The Gambia is also one of the few countries that have no mental health policy. And if you don't have a policy, you don't have a guide. There is no avenue that you can follow, no path that you can follow to achieve. My responsibilities are not clear. The responsibility of the ministry and other stakeholders are not clear. It is only when we have a National Mental Health Act and a National Mental Health Policy and a strategic plan that we will move forward. But also, as I said, our workplaces. Sometimes we have very stressful factors. Sometimes we work overtime. These are all challenges that we are facing, and these are all mental health issues. So it's not only those who are seeking treatment or those within the facility, but most of us have mental health issues, and we have things to do to solve those problems.
Okay, exactly. Thank you. And what's your organization doing about this?
My organization, as you introduced, is the Mental Health Leadership and Advocacy Program. Mental Health Leadership and Advocacy Program. One key area that we think the Gambia is lacking most is capacity building of our health staff and even non-health staff. This is why since we started operations in February 2012, we've tried to build the capacity of several health staff in the area of mental health. Because we don't want the person in Bajakunda to cover a distance of about 360 kilometers before coming to Banjul to be able to seek treatment. So in collaboration with the Ministry of Health and Social Welfare and also WHO, we've conducted a series of trainings for health staff to be able to render community mental health services where they are. But also, this program called the Mental Health Leadership and Advocacy Program have trained 4 health staff in the area of international public mental health and advocacy. We did this training in May and June. My program have supported 4 people from the Gambia, one from the Ministry of Health and Social Welfare, the National Mental Health Coordinator, Also, a staff from the Tanka